What's going on, everyone? My name is Nick. I'm a radiology resident in Minneapolis, and in this video we're going to be talking about how to get a strong letter of recommendation, because letters are crucial components of both the residency and medical school applications. They can show that you have both the professional and personal qualities for you to succeed as a medical student, a resident, and then later as a attending physician. Because these letters are written by doctors who know you and who have worked with you, they offer a much more personalized and qualitative view of who you are, which is in contrast to your grades and board scores, which are much more quantitative. Our behavior, attitude, and personality can be an important predictor of success as a resident, so for these reasons, medical schools and residency programs place a big emphasis on letters of recommendation. And because you won't be actually writing these letters, you might think, I don't really have that much control over their content, but the reality is that we can have much more influence over them than we think. All right, my first tip is for you to figure out exactly how many letters you need and then to send the right ones to the right program. Some medical schools have different requirements for which types of letters they want or who they want to write them. For residency, generally 3 to 4 letters is enough, but it also depends on the specialty that you're applying to and the specific programs that you're applying to. Of course, you could ask for more letters than that and then pick and choose which programs get to see certain letters, which might be helpful if you're applying to 2 different specialties or if you're applying both to MD and DO schools. My advice would be not to send in more letters than necessary, because some programs just toss out extra letters and you would have no idea which one that might be, and we definitely do not want it to be your strongest one. My second tip is to ask for the letter at the end of the rotation, at the end of the research project, or at the end of a course that you took. This way your accomplishments are fresh in the letter writer's mind, and you can electronically file away the letter until you actually need it. I know it can be hard to develop a close working relationship with a attending or a professor, so at the end of the rotation or at the end of the project, you could always choose to stay in touch with them via email by sending them periodic updates, and then choosing to meet with them in person to further discuss your career goals. Keep in mind that the goal here should be to land a strong letter of recommendation and not a lukewarm or a generic one. Keep an eye out for the mentors that you've impressed and work closely with, because they would be best able to write about specific experiences from your work together that can reflect your strengths. Ideally, this person would care about you personally and professionally, and also have really good writing and communication skills so that they would actually be able to write a well thought out letter of recommendation. Do your best to avoid getting a generic letter. And on that note, try finding a mentor who knows both the art and the science of writing an effective letter. A certain professor might think that you're the best student in the world, but this doesn't matter if they can't write well and then effectively convey that to the person reading it. You also want to think about if this person cares deeply about your future career goals, because you want them to write a very well thought out letter. I'd suggest asking classmates who are a year or 2 ahead of you who the professors are who write well and take an active interest in working with students. All right, my next point is that the prestige of the person writing the letter is important, but it's not the end all be all. Of course, a letter from the dean or the chair of a department would carry more weight than one from a chief resident, for example. The reason for this is because more acclaimed professors have built connections with professors at other institutions from collaborating on research projects, publishing papers from shared data, and from simply seeing them at conferences. If someone is reading a letter from someone that they know personally, then this simply carries more weight compared to the same letter written by someone who they don't know. Other people feel like more senior professors are harder to impress than junior professors, and although this might not be true, the people reviewing your application might be operating under this assumption. With that said, you might be tempted to ask, Professor Bigwig, hey, can you write me a letter? But I would urge you to resist doing this unless they actually know you very well. A rockstar letter from a faculty who's less well known, but who's worked closely with you, is much better than a generic one written from the department chair. Another piece of advice is to think about how you ask. For example, you could ask Professor so-and-so, hey, could you write me a letter for medical school? But anyone could write you a letter, and the key here is to ask for a strong letter of recommendation. So the way I would ask is saying, hey, Dr. So-and-so, do you feel like you know me and my work well enough to write a letter on my behalf for medical school or for residency? By phrasing it this way, you kind of give them an out if they don't feel comfortable writing you a letter. And if this happens, consider yourself lucky. It's all good, because the last thing you want is a lukewarm or a generic letter. I would also suggest not asking for the letter in the hallway or in between patients or via email, because it would be much more professional to basically just schedule a meeting in person with them. All you have to say is, Dr. So-and-so, do you have 15 minutes to meet in person and discuss my career goals, because I would appreciate your advice? And if so, when would be best to do that? Remember, they're kind of doing you a solid, so you want to be polite and formal about things. By asking for the letter face-to-face, it'll do two things. The first is for your professor, it'll remind them who you are and what you've done together. And the second thing is for yourself, because you'll be able to gauge, hey, is this person kind of hesitant or ambivalent about writing it? Of course, if it's super obvious that this person is kind of on the fence about writing you a strong letter, all you have to do is thank them for their time, kind of let them know that you're moving on and that you'll be asking another professor instead. Unfortunately, it's far too easy for someone to write a generic letter with lots of adjectives talking about how great you are, but without specific evidence that kind of supports these opinions. Details are far more convincing than empty praise, and although you won't actually be writing the letter, you could always provide specific examples to your letter writer about the work that you've done together. A specific example of this type of evidence would be when you maybe had the first draft of a case report ready within 3 days, or you took a really heavy patient load at the hospital and then still took the time to educate other students on the team. Also, don't assume that letter writers always know exactly what to say, because that's not always the case. The perfect letter has information about your medical knowledge, your clinical judgment, your motivation and empathy and compassion, as well as your work habits and interpersonal communication skills. So the perfect letter actually covers quite a lot. For example, if you're applying to a surgical residency, then it would be important for there to be comments about your hand-eye coordination in the operating room and your procedural skills, but it might be a little pretentious if you ask your letter writer to specifically comment on these things. I think maybe a more professional way of going about things would be to send them a formal email with your CV, your personal statement, transcript, board scores, and then in that email, share a story or an anecdote from your time together. Also, don't forget to give them a deadline. So by doing all of these things, it'll color their understanding of who you are, what you all did together, and when this letter actually needs to be submitted. If the letter writing process is easier, then it's much more likely for you to end up with a strong letter recommendation. I'll drop an email template here for you to use, and feel free to screenshot it for when you ask for your letter down the line. All right, another tip is don't wait to ask for the letter. I know it might feel like we're imposing when we ask to meet with a certain professor, but the reality is that they expect this, and writing letters is just another part of their job. Try not to overthink too much about who you're gonna ask, because ideally you still need to give this person at least 1 to 2 months to write the letter, so that way they don't feel rushed. After all, they have other responsibilities as well, and ultimately you want them to do a good job. Remember, the worst thing you can be told is a simple no, so if this happens, don't worry about it, and just move on to the next person on your list of potential letter writers. And I'll end by saying, don't forget to say thank you. It's easy to forget about this in the middle of application cycles, because we really are making big decisions about our future, but don't forget about the people who have gotten you this far. Make sure to follow up with them in 1 or 2 years down the line with life updates and career updates, because they're always interested in the success of their students. For both my med school and residency letter writers, I'd get them a nice bottle of wine and then send a handwritten thank you note just to show my appreciation for their support. Once you're accepted to med school or you match into residency, don't forget to keep them updated with where you'll be training. Plus, you never know when you'll need this person's help again in the future. So that wraps up all my tips for getting a strong letter of recommendation. I hope you find it helpful, because when I was a pre-med, I definitely remember wondering how to go about all of this stuff. If you learned something here that you think you'll use in real life, then I would love to hear about it in the comments below. And as per usual, make sure to smash the like and subscribe button. Follow me on Instagram if you aren't already, and I'll see you in the next video.